Some peptic ulcers may be caused by Helicobacter pylori, also known as H. pylori. H. pylori infections are typically treated by a combination of antimicrobial drugs and PPIs. Patients with H. pylori associated ulcers are treated for about 10 to 14 days with a standard triple therapy consisting of a PPI and 2 selected antimicrobial drugs. Alternatively, a standard quadruple therapy with a PPI and 3 antimicrobials may be considered. The H. pylori bacteria must be eradicated for successful treatment of the peptic ulcer. An antacid is a drug that reduces symptoms of indigestion and heartburn by neutralizing the hydrochloric acid, the HCl, in the stomach. This increases gastric pH, makes the stomach's pH less acidic, which reduces gastric irritation. Antacids are typically formulated with at least one of the following ingredients: calcium, magnesium, and aluminum. Antacids are most often used in combination with other drugs to treat a number of GI conditions, including PUD, gastritis, gastric ulcer, peptic esophagitis, hiatal hernia, gastric hyperacidity, and GERD. In most cases, antacids are not used as the primary treatment for these disorders because they provide only temporary relief and do not prevent any future attacks. Antacids are often available as combination drugs, so review drug information carefully before giving. Timing of antacids related to meals and other drugs is important. Many drugs bind with antacids and lose effectiveness. In general, antacids should be given 1 hour before any other drug and 2 hours after any other drug. Patients with heart failure or other cardiac disease should avoid antacids that are high in sodium. The example of these drugs is aluminum hydroxide, also known as Alternagel, calcium carbonate, known as Tums, magnesium hydroxide, known as milk of magnesia. Use of antacids as directed rarely results in significant side effects. In general, brands with magnesium can cause diarrhea. Brands with calcium or aluminum can cause constipation. Other side effects include loss of appetite, frequent burping, nausea and vomiting, fatigue, and weight loss. Adverse reactions are usually specific to the type of antacid. For example, if the patient is taking magnesium-based antacid, adverse effects are usually related to hypermagnesium, such as muscle weakness, low blood pressure, and low heart rate. Adverse effects of calcium-containing antacids include bone pain, kidney stones, and, in severe cases, cardiac dysrhythmias. Aluminum-containing antacids can cause mood changes, confusion, osteoporosis, and hypercalcemia. A major concern about all antacids antacids is their impact on absorption of other drugs. For this reason, timing of administration of the antacids related to meals and other drugs is very important. Always consult your drug reference before you give an antacid. The general nursing considerations is to teach the patients to avoid eating 3 hours before bedtime to help reduce the risk of reflux while laying flat in bed. Recommend that the patient stop smoking because nicotine increases stomach acid. Recommend that the patient eat smaller portions at mealtime. Tell the patient to notify their healthcare provider if they take H2 receptor blockers for longer than 2 weeks because these drugs can lose their effectiveness over time and the patient may need different drugs. GERD and PUD have symptoms similar to those of cancer of the stomach, and overuse of over-the-counter drugs can mask symptoms of other healthcare problems. For patients with PUD, monitor vital signs regularly. Notify the healthcare provider, and any increase in heart rate or decrease in blood pressure that may indicate internal bleeding. Monitor the level of consciousness while the patient is taking drugs for GERD and PUD because these drugs often cause confusion or restlessness, particularly in older adults. Teach the patients to avoid driving, using heavy machinery, or making important decisions while taking these drugs because they do cause drowsiness or confusion in some cases. Tell the patient to report severe dizziness or changes in stool color, especially if it's black, because these may indicate that there is internal bleeding. And the nursing implications of planning, in addition to general nursing considerations related to the care of the patient with PUD or GERD, antacids are available over the counter and in a variety of flavors and forms to help make them more palatable to the patient. Depending on the brand, antacids can come as liquids and as chewable tablets or gummies, or as tablets that dissolve in water. The neutralizing abilities of antacids vary, and one type of antacid does not necessarily produce the same result as another. The sodium content of various antacids must be carefully assessed before giving them to patients who are on a sodium restriction intake. These patients include pregnant women and patients with heart failure or other cardiac conditions, hypertension, edema, or renal failure. Antacids neutralize gastric acids and are typically most beneficial if given between meals and at bedtime. Make sure that the patient understands that taking the drug exactly as it's prescribed, generally 1 hour after that meal and right before bedtime, is most beneficial. If the patient has diarrhea or constipation, these are common side effects of different antacids. And if it becomes a significant problem, make sure that they contact their healthcare provider. To avoid adverse effects, never take more than the recommended dose. Antacids are used for short-term treatment. They do not prevent future attacks. And if they are taking a chewable antacid, they need to make sure that they chew it thoroughly before swallowing it and take it with a full glass of water. If they are taking a liquid suspension, they need to make sure that they shake the suspension very well to mix it thoroughly before pouring their dose. A histamine H2 receptor blocker decreases gastric acid secretions by inhibiting the binding of histamine and H2 receptors on the parietal cells in the stomach. This leads to a decrease in production of basal gastric acid, the minimum amount of acid your body needs throughout the day, and nighttime gastric acid. It also decreases the amount of gastric acid released with meals and substances such as caffeine. The drugs may be used intravenously before and during long, major surgical procedures to prevent ulcer formation resulting from physiological stress of surgery. Over-the-counter doses are typically about 1/2 of the prescription dose. Patients who are taking over-the-counter histamine H2 receptor blockers should not take them for more than 2 weeks without seeing a healthcare provider because they may have more of a significant health issue. Monitor the patient for signs and symptoms of restlessness or confusion because these side effects may increase the risk for falls. Patients with impaired renal function will typically receive lower doses or have increased time between doses. Examples of these drugs are famotidine, known as Pepcid AC, and nizatidine, known as Axid. Expected side effects include headache, nausea, diarrhea or constipation, and mild abdominal pain. Some patients have mental status changes, including confusion, anxiety, or depression. These usually resolve when the drug is stopped. Adverse reactions to H2 receptor blockers are rare and include severe allergic reactions, a variety of blood disorders, and cardiac dysrhythmias. Although the reason is not fully known, patients may also be at risk for pneumonia. The drug interactions for H2 receptor blockers can affect certain enzymes in the liver that metabolize drugs. This can result in changes in how certain drugs are metabolized in the body, including warfarin, beta blockers, benzodiazepines, calcium channel blockers, and alcohol. Contact the healthcare provider or pharmacist if there are any concerns about interactions. Planning and implementation, in addition to the general nursing considerations related to care of the patient with PUD or GERD, the following issues and actions are important. Assess the complete blood count and check for the unusual bleeding or signs of infection. Monitor patients for changes in mental status, such as confusion or anxiety, after beginning the H2 receptor blockers. For best effects, these drugs should be given with meals and at bedtime. Once daily dosing H2 receptor blockers is best at bedtime. Reduce symptoms of acid reflux at night. Avoid cigarette smoking because it increases gastric acid production and can decrease the effectiveness of these H2 receptor blockers. Take H2 receptor blockers only for occasional episodes of heartburn because they can lose their effectiveness if symptoms continue. Contact your healthcare provider for diagnoses and treatment. Do not drive or operate machinery until you see how the drug affects you. These drugs may cause dizziness in some people. Use the handrails when you are using stairs in case you have any dizziness. Ask your family members to observe if you have any changes in mental status, such as confusion or anxiety and depression. Proton pump inhibitors, PPIs, are a class of drugs that help heal gastric ulcers and reduce symptoms of GERD by stopping the acid secretory pump that is located within the gastric parietal cell membrane. They bind to the proton pump of the gastric parietal cell, which blocks acid secretion into the stomach. PPIs are used to reduce gastric acid in a variety of conditions, including GERD and PUD, or in the combination with other drugs to treat H. pylori infection. They also may be used in acute care setting to decrease the risk for stress ulcers in critically ill patients. Length of treatment varies according to the type of illness, but typically is about 4 to 8 weeks. In some cases, longer-term treatment may be indicated for patients who produce excessive amounts of gastric acid. Some patients may need the drug for as long as 5 years. Some examples are S-meprazole, known as Nexium, lansoprazole, known as Prevacid, omeprazole, known as Prilosec, pantoprazole, known as Protonix. The nursing implications is to give with a full glass of water 30 to 60 minutes before the first meal of the day for maximum benefit. Over-the-counter PPIs should not be taken for more than 2 weeks because failure to relieve symptoms may indicate a more severe health problem. PPIs may be prescribed for 2 to 8 weeks depending on the patient's presenting condition. Make sure to teach the patients that it may take several days to experience relief after beginning a PPI. If the patient has H. pylori bacteria in the stomach, the PPI will be combined with specific antibiotics to treat the infection. Remind the patient to take the full prescribed antibiotic therapy. The common side effects include headache, mild abdominal pain, nausea and vomiting, flatulence, which is passing gas, and diarrhea or constipation. Many patients experience increased sensitivity to light, also known as photosensitivity. Less common side effects include dizziness, anxiety, and mild rash. Low vitamin B12 levels leading to anemia may develop in patients who have taken PPIs for more than 1 year. Possible adverse reactions include severe allergic reaction, pancreatitis, and blood abnormalities including thrombocytopenia and hemolytic anemia. Sustained gastric acid suppression by PPIs has been associated with other adverse effects, including increased risk of Clostridium C. diff infection, low magnesium and iron levels, and chronic kidney disease. There is some concern that decreased calcium absorption in the stomach may place the patient at risk for osteoporosis, bone fracture with long-term use. The PPIs inhibit certain enzymes in the liver that are involved in metabolizing other drugs. This is important because PPIs can increase or decrease the effectiveness of those drugs. Some examples include warfarin, alprazolam, drugs given to treat tuberculosis, such as rifampin, and certain drugs used to decrease blood cholesterol.